Welcome to Diagnostic Imaging's Weekly Scan. I'm Whitney Palmer, Senior Editor. We're back with you this week with the latest updates on the COVID-19 outbreak and its impact on the radiology industry. Last week, the journal Radiology published a story about the brain abnormalities seen with MRI in patients in the intensive care unit who were positive for COVID-19. The research determined that 44% of these patients experienced neurological symptoms. However, many in the industry have expressed concerns about the strength of the study and what the findings mean. This week, Diagnostic Imaging talked with Dr. Christopher Hess, Distinguished Professor and Chair of Radiology and Biomedical Imaging at the University of California at San Francisco, about how radiologists should view these study results. While the study findings do show a potential association between the virus and neurological findings, Hess said, the results were not able to show a direct causal link. Ultimately, he added, these outcomes underscore the need to continue to gather data via imaging in order to better understand the impact of the virus. Throughout the pandemic, diagnostic imaging has been used to monitor and manage COVID-19 progression. However, research published in the Journal of Ultrasound and Medicine showed that contrast-enhanced lung ultrasound reveals patterns in the lung that were not typically associated with viral pneumonia. Citing 3 male patients positive for COVID-19 who exhibited symptoms of pneumonia in Italy, investigators found large perfusion defects in a pattern not usually seen with pneumonia or lung collapse. They conducted X-rays and ultrasounds and found abnormal early arterial enhancement, incomplete enhancement of major consolidations, sharp boundaries between perfused and non-perfused areas, and no enhancement of consolidations less than 2 centimeters. The researchers said physicians can use contrast-enhanced ultrasound to help guide treatment plans with patients who are COVID-19 positive. As you have no doubt experienced, a drop in revenue has accompanied the reduction in imaging volume that has been seen throughout the pandemic. There are ways for you to begin to recoup that money, however. Dhruv Chopra, Chief Executive Officer of radiologist-owned Alliance Collaborative Imaging, outlined 3 strategies to help you recapture revenue, including how to enhance your revenue cycle, ways to identify gaps in your current billing service, and methods for using automated workflow solutions to prepare for spikes in business. News this week also emerged about follow-up care with mammography and breast cancer. Although it has been standard procedure to conduct follow-up imaging after 6 months on women who have a BI-RADS-3 score, the protocol has been debated within the specialty. In research published this week in Radiology, investigators from the University of Pittsburgh Medical Center Magee Women's Hospital analyzed the medical records of nearly 44,000 women who had 6-month, 12-month, and 24-month follow-up imaging after receiving a BI-RADS-3 assessment. According to their results, nearly 2% of women were diagnosed with a new breast cancer during follow-up. Roughly 58% of those cancers were identified at or before the 6-month mark, and 12% of those cases were diagnosed as invasive cancer. In other breast imaging news, the conversation continues about the role, benefits, and challenges of abbreviated breast MRI. While the service has been found to be equally accurate, take less time, and cost less, clinical implementation has been slow to take off. In an article published in the Journal of Breast Imaging, researchers from NYU Langone Health discussed the benefits and challenges of using abbreviated breast MRI, as well as outlined the strategies and methods that practices and imaging centers can use to more easily integrate it into the services they provide to patients. Amid all the studies and clinical evidence that continues to emerge about COVID-19, a Medscape survey published this week revealed good news for the radiology industry overall. According to feedback from more than 17,000 physicians, including approximately 500 radiologists, radiology ranks among the top 5 highest paid and happiest specialties. Compared to the previous year, radiology experienced a 2% income increase, raising the annual salary to roughly $427,000. This is compared to an average yearly salary of $346,000 for other specialists and $243,000 for primary care physicians. Those who compiled the survey did acknowledge that this data was collected prior to the pandemic, indicating the outbreak has led to a loss of 43,000 healthcare jobs, a 60% drop in patient volume, and a roughly 55% dip in revenue. Still, radiologists overwhelmingly reported at 93% that if given the chance, they would choose the specialty all over again. And finally this week, Diagnostic imaging turned its focus to the patients you see who are affected by COVID-19. For many who experience symptoms and the need for some form of diagnostic imaging, it will be the first time that they've had a chest x-ray or a CT scan, and the experience can be frightening. Making those patients feel comfortable and calm can be critical to capturing images of high quality and high diagnostic value. To shed light on how you can put your patients at ease, Diagnostic Imaging spoke with Randy Homan, multimodalities supervisor at Novant Health Huntersville Medical Center in North Carolina, about the strategies she and her staff use to educate patients about what to expect with a scan, as well as to allay any fears that they might have about the process. Here's what she had to say. Welcome to Diagnostic Imaging. I'm Whitney Palmer, Senior Editor. Throughout the COVID-19 pandemic, a great deal of attention has been given to how the virus has impacted imaging volumes and the daily workflow for the individual radiologist. But the virus has also had a significant impact on the patients who are being sent for the chest CT or chest X-ray studies that could potentially reveal whether they have been infected by the virus. For many patients, going through that process can be frightening. Today, we are joined by Randy Homan, Multimodalities Supervisor for Novant Health Huntersville Medical Center in Charlotte, North Carolina. She is with us to discuss the importance of making patients comfortable throughout the imaging process and the steps her facility has taken to make that possible. Thanks so much for joining us today, Randy. We greatly appreciate it.
Thank you so much for having me. Happy to be here.
Great. Well, let's jump in. First, give me an idea of how busy Huntersville has been with imaging patients for possible COVID-19 infection. What types of volumes are you seeing and what scans have you been providing most often?
So since the COVID-19 pandemic has started, we have definitely seen an increase in patients presenting with the COVID-19 like symptoms into the emergency department. So since about March, that volume has definitely spiked. And so those patients who are coming in with those COVID-19 like symptoms, most likely the emergency room provider is going to order either a chest x-ray and or a CT scan of the chest. So we have definitely seen an increase in those procedures being ordered.
All right. So then when you talk to these patients, what do they tell you? What are their concerns or their fears in going in for an imaging study?
A lot of those patients don't want to be viewed as an alien, so to speak. The media has really painted the picture of people who have COVID-19 are, these infectious people. So the patients are definitely expressing fear of being labeled or categorized as a certain, patient population. So they're nervous about that. They've also seen a lot in the media about being intubated or on a ventilator. And so sometimes the hospital team, we have to reassure them that, we'll do everything possible to get them through this journey. And everyone does experience COVID-19 differently, and they may not necessarily need, to be intubated and be on the ventilator. So patients are definitely afraid, and we are just trying our best to comfort them and reassure them.
All right. Well, what about concerns that they might have when it comes to the imaging process? For some people, it may be the first time that they've had to get a CT scan or an X-ray. So are there concerns or doubts and fears there?
Yes, patients definitely have concerns over the imaging that may be ordered associated to COVID-19. And you bring up a great point. Sometimes it is those patients' first time ever having a chest x-ray or ever having a CT scan. And so they're curious, how does it work? Is it hurt? Does it take a long time to do it? And we, again, just have to reassure them that it's just to really get a detailed view of your chest and your lungs and to make sure this COVID-19 is not spreading or presenting as another type of illness or pathology.
All right. Now, you kind of touched on this next question, but when you're dealing with a patient who does have a fear, what are some of the strategies that you have found that work best to allay those fears? Maybe it's an emotional attempt or even an educational attempt to kind of make them feel more comfortable with the process.
Yeah, so to make them feel more comfortable, our team here at Huntersville Medical Center, we definitely provide the emotional support and we want the patient to feel heard. So, body language goes a long way. Eye contact, and more than likely, we're going to have a ton of PPE on. And unfortunately, that PPE includes a mask. And so the patient cannot see your mouth. So me personally, try to smile with my eyes and just speak very clearly and just make them as comfortable as possible while they're in imaging. Again, body language, reassuring them with words of affirmation, warm blankets, just explaining the process, explaining why we're wearing all this PPE, because it can look very intimidating. And I want them to understand why we're wearing it, and it's for our protection as well as their protection too.
All right. Well, then what about education when it comes to the exams themselves? Again, touching on that first time of having an imaging study, what are some of the things that you tell folks when it comes to helping them understand what you're going to be doing and what you're going to be looking for with COVID-19?
Yeah, so for the COVID-19 patients, let's say the ordering provider wants a CT scan of the chest. The patient would arrive to the CT department and the technologist would, as detailed as possible, explain the type of scan they're going to be doing, why they're having that done, the importance of looking at their lungs, looking at their heart, because COVID-19 does affect those areas of the body. And so we want the patient to understand it's really important to have this scan done so that the radiologist can read the scan and work with the ordering provider on the best plan of care moving forward. So we try to explain to the patient, like I said, why it's important, what we're looking at. It only takes a few minutes and it does not hurt. And most patients, after being told the why and explained, they're pretty comfortable moving forward with it.
All right. And overall, jumping off of that point, what kind of feedback have you received from patients? Maybe ones who weren't necessarily that concerned to begin with, to the ones who have experienced the most fear coming into the radiology department.
Feedback from those patients has been kind of all over the place after they go through imaging. A lot of them are like, oh, that was a piece of cake. Or some of them are still a little nervous afterwards, thinking I might have to have this done again. And it just is kind of all over the board. Patients, unfortunately, who might be intubated on a vent, they're not awake to know that they're having the imaging done. So then we would rely heavily on just communicating to the loved ones of that family member, what we're doing. But patients' feedback has been anywhere from, wow, that was a piece of cake, to still might not want to do that again, but if I have to, I will.
Well, what about feedback from the technologists and the radiologists? Sometimes it's difficult to image a patient who's nervous. So what have they told you about your efforts as far as making a change and perhaps making their jobs easier?
Yes, I'm glad that you bring up that point, because as we're trying to make the imaging process less stressful for the patients, that starts with making the technologist team feel less stressed as well. So making sure that the technologists have all the PPE they need, making sure that the leadership team, the radiology leadership team rather, is keeping the technologists up to speed on the latest and greatest with COVID-19. So our team here at Huntersville Medical Center feels very informed, very educated. We've always had the PPE that we need. The radiologists and radiology providers also feel that way. So just maintaining open lines of communication is really important. Another thing that Novant Health as an organization implemented when this pandemic first started was regular calls with the entire radiology leadership team, and that included radiologists, so that we're all on the same page. We're implementing plans and strategies together, and it's been very successful.
All right. Well, digging a little deeper into that, if you were to talk to someone in a neighboring radiology department or a colleague somewhere else in the country who maybe is looking to create a situation where they can provide more comfort for a patient, what are some of the steps that you would suggest they take to kind of start down that road to making sure that patients feel as comfortable and confident walking into the radiology department?
Yeah, so we definitely want our patients to feel comfortable and confident coming into the radiology department. There are different strategies that we've adopted with Novant Health in the imaging department. For outpatients, that includes maintaining social distancing in your radiology waiting rooms, not allowing patients to sit too close together, have a robust screening process, and that starts with the scheduling team, really. So we've partnered with scheduling. So when they're scheduling outpatients to come in, they're setting up the patient for the realistic expectation. You will be screened, there's social distancing measures in place, really wanting the patient to feel safe and confident before they even get to the facility. And then for inpatients and our ER patients, while they're not going through the radiology waiting room, explaining to them that we do ample cleaning of our procedure rooms, watching. We do make an effort for the patient to see us wipe and clean down the room while they're still in there, seeing the technologist sanitize. So having the HEPA filters in the room, explaining that to the patient. So at Novant Health, we're really trying to just take all the steps to make the patient feel safe and comfortable and confident with the imaging process.
Right. Well, then stepping back to around a 50,000-foot perspective, within the environment of COVID-19, what has all of this taught you about the importance of making sure that patients do feel comfortable and at ease with the services that your department provides?
Well, at Novant Health, our top priority is, of course, patient safety, and right under that's going to be the remarkable experience. And so I've learned that you really need to do everything possible for the patient. You want to ensure their safety. You want to ensure that they're comfortable. Maintain an open mind with these patients. They're all still human beings. So like I mentioned earlier, sometimes they're being categorized as the COVID-19 patient. Well, they're all still have unique personalities and their own friends and family. And it's just important to keep that in mind. And again, I've learned that anything we can do to go above and beyond to maintain safety and comfortability and confidence is of the utmost importance to us.
All right. Well, Randy, I appreciate you taking the time this afternoon. Thank you so much.
Thank you.